My name is Zhuoheng Yin, and our topic is outcomes from the community clinic hybrid PrEP approach as a part of clinical trial in China. Since oral PrEP was examined effective in preventing HIV infections, these prevention strategies were approved by China to be used for decreased acquisition rate among key population, such as MSM. But data on PrEP uptake, persistence, discontinuation, adverse events, and HIV incidence among the Chinese at-risk PrEP users is limited. Today, our speech will focus on the implementation model we used for PrEP dissemination and report some indicators as well as results of the preliminary data. So, we conduct a PrEP phase 4 clinical trial to address the above-mentioned questions, and 1,020 participants. 200 participants were planned to be recruited in two sites in China, which is Wuhan and Guangzhou, like two of the biggest cities in the middle and thousand of China. Key population with recent risky behaviors aligned with the guidebook of PrEP use in China were enrolled and received the laboratory evaluation. All participants will be provided with 12-month FTC combined TDF for the oral prescribed PrEP, and they get monthly review in the first 3 months and quarterly follow-up in the remaining 9 months. Surveys were executed every 3 months. So we use a clinic and CBO hybrid model to implement our phase 4 clinic trial. The local well-known community organizations in the two cities were involved, including Wuhan LGBT Center, such global positive partners. In terms of the clinics, providers who were qualified to PrEP prescription were engaged, which were Zhongnan Hospital of Wuhan University and Guangzhou 8th People's Hospital, Guangzhou Medical University. Referencing the whole process of the PrEP cascade, we divide them into 4 components. For the promotion and recruitment and rapid test screening, we had a major outreach plan conducted by CBO. First, local organizations disseminate the messages to the chat group or the public account operated by themselves to get the appointment for those participants who gained interest in PrEP. And then minority-oriented social media platforms such as the mobile dating apps or websites were also used for us to spread the promotion information which might be restricted from the clinics. And at last, the peer referral strategies were used for outreach. This actually helped us to reach out for our prioritized population effectively comparing to clinics. And peer navigator were highly integrated in our risk assessment, first counseling and laboratory test. Since outpatient visits were believed as a challenging task in China, CBO played an important role for supporting this section. Lots of CBO workers were get trained in China of the volunteer consultation and the testing, and be able to perform the risk assessment and the initial screen of the participant in the CBO sites or companion at the clinics. So after the preliminary screening, introducing and educating about PrEP, eligible participants were referred to clinics to get the laboratory test, and with the procedure of anonymous treatment, some of the abnormal results will be notified by the CBO workers or the information system of the clinics. In terms of the clinic CBO hybrid model for the PrEP dispense, we conducted an innovative way to simplify this procedure. The prescription were delivered by providers, and but medication sent were mediated by CBO workers. Specifically, the medicines were multi-site stored in the clinics and the CBO center as PrEP is stable and can keep quality easily. Then, after the qualification check of the follow-ups, the medicine can be dispensed through outpatient pick-it-up or postal delivery after the prescription at every cost of 2 days. At last, for the follow-up session, 24-hour and 7-day CBO counselors were set to address the issue confronting during the medication use for our PrEP users. When participants reviewing adverse events or side effects, CBO worker will talk with the doctor in time to get response for our participants. And also, CBO coordinate the clinic visiting and notification by sharing the backstage information of the clinic in this delivery model. So, for the outcome we report today, which is Most of them are descriptive, including the social demographics, PrEP persistence, discontinuation, and adherence. So from the 2021 to 2023, 3,649 participants were recruited, and eventually 1,138 participants eventually start oral PrEP. And our participants were young, majorly were gay, and with high educational background. So for overall PrEP persistence rate, we could find that it is decreased over time from like 83.7% to around 60%. And for participants who discontinued, major of them quit at very initial 3 months. And the common reason for discontinuation were lost to follow-up or personal reasons such as low perceived risk, hard to adhere too far away from the hospital. As for the adherence rate of the participation, we count the discontinuation participant into this section. So we found the general self-report adherence rate was decreased in total, and about half of the participants were using the on-demand way at the beginning, and we could see that more participants were using had a history of the regimen change in the duration, and more of them choosing the way from transition from daily regimen to on-demand in the whole period. And generally, about 40% of participants choose the postal delivery to get PrEP medicine. At last, the reported adverse events were listed in the left side, and most appears of the symptom were nausea and dizziness, and up to 2023, 6 participants seroconverted, and results in the HIV incidence rate of 0.53 per 100 years. And notably, we discovered 2 rare accurate facial neuralgia participants who appear instant facial discomfort after PrEP prescribing and was self-recovered around 48 hours. The detailed information was published in Sexual Health Journal. So, I think this abstract presentation primarily gives the overview of the data from the trial. But in the future, we are going to do more subgroup analysis to demonstrate more information about the above-mentioned outcomes. And in the conclusion session, we basically emphasize the hybrid CBO integrated model proved feasible for reaching and dispensing. Also, the localized experiences of on-demand use of PrEP and mail order in China's context. Last, the long-term PrEP persistence and optimal adherence continuously decreased among Chinese users during the 12 months. So we would like to I think I speak too fast. We would like to extend the acknowledgement for all the implementers and collaborators, as well as the sponsors, Gilead Sciences. And also, if you have any interest for our program and project, please refer to the poster gallery to get more indicated works of the number 202-147-196-194 for more information. And thank you and welcome all the questions and suggestions about our implementation model and our clinical trial. Thank you so much.
Thank you very much, Dr. Yin.